You are in a safe place here. Oh, thank you. So I can have a look at your history. Everybody will most likely laugh at you when you tell them that you suspect to have Ehlers Danlos Syndrome. But we are here today to figure it out together. If you can look up for me, please. You'll see how stretchy and flexible it can be. As I'm poking. Stay still. Don't move. It's really hard to, find the balance, and again, this is what brings to injury then. Okay. Hi, welcome. Please have a seat and tell me, why do you think you have Ehlers Danlos Syndrome? Oh no, let me wear my gloves as I immediately tell you that you are in a safe place here. I know that many times you might have been judged by people, even by doctors, most likely. Yes, but you're safe here, okay? You are in a safe space, surrounded by professional people that are only interested in your health. So my question was just to understand which symptoms got you feeling like you probably had this condition, not to question it at all. So do you have any history, papers about any traumas or things like that I can have a look at while I listen to your story? Oh, thank you. So I can have a look at your history. So apparently, from what I can read here, you happen to have quite a lot of injuries, ligament tears, concussions. You even had a surgery. Okay. And overall, you happen to suffer of headache, acid reflux. Alright, I see. Okay, this is very important for us to understand your history, all your injuries and trauma. On a daily basis, how do you feel? Do you happen to have chronic pain? I know that all your symptoms belong to so many different fields, and of course specialists only focus on their own field, so it's not easy to come up with this diagnosis. So what made you suspect, or who made you suspect that you actually had EDS? An ASM artist? Who, if I can ask? Oh, Grace, okay. After that video, you started researching and found out that you probably had a lot of symptoms. Yes. I know doctors really find it hard to classify somebody with Ehlers Danlos. It's a very rare and complicated conditions. Today, there are 13 different categories of Ehlers Danlos Syndrome, and it's usually hereditary. So this is why, especially for the one that you suspect to have, which is the hypermobile kind, it's really hard to have a diagnosis. I know. And it's a very hard path. Everybody will most likely laugh at you when you tell them that you suspect to have Ehlers Danlos Syndrome. But we are here today to figure it out together, okay? I believe in you. I will not laugh at you. I am sure that if something brought you here doing so much research, it's because you do need some answers. And today we will find those answers together, okay? One thing that can be of any consolation is that the hypermobile kind of Ehlers Danlos syndrome is not hereditary, not necessarily. So that's already a sign that you're not in the wrong place, okay? But talking about your family members, do you by any chance recall of cases of hypermobility or easy injuries in your family? Okay, so you're not the only one experiencing this hypermobility. All right. So you told me that every day you happen to have cervical pain. Can I just gently touch your neck area to see the consistency, if there is any tenderness or anything abnormal? Thank you. Alright, so when you have Ehlers Danlos syndrome, basically your ligaments are very weak, which cause a lot of instability. And of course, this is very heavy on the joints and on the nerves, and this is causing pain and inflammation. So this is why your cervical pain and headache and migraines are so frequent. Basically, it's like your head that should be supported by your spine. We should be surrounded by a lot of muscular tissues and ligaments and all of that. Is actually kind of like balancing a balloon on top of a needle, and the instability is always being very heavy on your cervical area, on your neck. And this is of course one of the possible reasons of your headaches, cervical pain, neck pain, tightness all over this area, okay? So this is certainly something that we need to be aware of, okay? And so is the acid reflux. Basically, your ligaments are so loose, and it's absolutely normal that more mucus is produced and you happen to have this acid reflux, okay? So it's all starting to make sense, isn't it? Alright, so now there are a couple tests that I would like to ask you to perform. And I do have this condition myself, so I can show you a couple here. Of course, not too many because of logistics and because I don't want to get injured myself. But basically, there are some things that are typical of the Ehlers Danlos hypermobile syndrome. One of them being able to touch your thumb and your wrist. Okay? keeping your 90-degree angle here, okay? So if you can do this, like this, you most likely have EDS, okay? So can you do that? Alright, yes. Same thing with your other fingers. Can you bend them below 90 degrees? Just try with your fingers to bend them. Of course, do not hurt yourself. Do what you can here, okay? And if you can really bend them like a huge lot, that's probably because you have a hypermobile syndrome. Can I even try to bend them myself? I'll be very delicate, I promise. Okay, thank you. Going with the thumb, the index, middle finger, ring finger, pinky finger, other hand, the thumb. Am I hurting you, by the way? Index, middle finger, pinky finger, and ring finger. Yes, your hands are definitely very, very loose, which clearly indicates the possibility to have this condition. Another typical sign of Ehlers Danlos Syndrome is this thing right here on your wrists. You see this tiny little kind of bubble. Okay, this tiny little bubble right here that appears. It's a weird consistency bubble. You can kind of push it, even squish it. So if you apply a gentle pressure onto your wrists and this bubbles appears, just like these ones, you most likely have EDS. And you also might happen to have them in your heels. So if you don't mind, I would just want to have a look. Okay, I'm just going down and have a look. Just to stay comfortable on your feet. I can definitely see that in your other heel as well. So that's another sign that you have Ehlers Danlos Syndrome. So I would like to ask you if you could possibly bend with your legs straight, close to each other. Bend over and see if you can touch your toes. Okay. Go ahead and do that, of course. Be careful not to get injured. Oh, you can definitely pass your toes. That's another sign of Ehlers Danlos Syndrome. Also, can I have a look in your eyes? Sometimes there are some signs of Ehlers Danlos Syndrome, even inside your eyes, if there is any extra vascularity or irritation. So if you allow me to, I would just delicately open up your eyes and have a look at your eyeball. Thank you. So, if you can look up for me, please. Good. And now look down for me, please. Okay, good. It doesn't look like your eyes are acting weird whatsoever, but I can definitely tell that all the other symptoms are typical of the Ehlers Danlos Syndrome. Also, we tend to have a very thin, delicate, stretchy skin. So if you don't mind, I would like to have a look at the consistency of your skin, okay? Do you usually, like, just for curiosity, pull it and see if it's just very, very stretchy? Yes, I know. Okay. And do you have a lot of stretch marks on your body? I see. Okay, if you don't mind, I'm just going to touch your skin, very gently pinch it, and have a look at the consistency of it, okay? Alright. So, yes, I'm poking, 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 just poking, poking your skin. It feels very, very stretchy, very loose. Yeah, definitely, definitely very stretchy and loose. Okay, yeah, I'm having a look even at the rest of your body, if that's okay for you. So just have it up here at the consistency of your skin. Yes. Okay. And even here, having a look again at the consistency of your skin, how stretchy and loose it can be. Good. Okay. Yes, your skin is definitely very stretchy and loose. Also, another thing, can you rub and make your pinky finger and your thumb touch? Yes, and also show me your fingers, because sometimes when you have Ehlers Danlos Syndrome, not only your fingers are very loose and stretched, but also very long, and your fingers do look quite long instead, in fact. Yeah. I now just want to have a look if you can, like, straighten your arms, both of them, if they hyperextend and just don't go in a straight line like this, but they just hyperextend a little bit. I would just have a look at that. So if you can just straighten your arms for me. Good. Good. Yes. I'm also going to gently move the joints around to see how stretchy and flexible it can be. Always tell me if I'm hurting you, of course. Okay, also I'm doing the same thing with the other arm, okay? Just bend and straighten and move the joint around a little bit. Yeah, it's very loose, very, very loose. Alright, okay. Can I just have a look at you standing in a normal position? I want to see if you have some knee hyperextension as well. Yes, you do have some knee hyperextension, and that's another typical sign of Ehlers Danlos Syndrome. I would like to now ask you to close your eyes and just stand in front of me. Stay still, okay? You close your eyes and stay still. Don't move. Just stay still in front of me. Don't move as I check your balance, okay? I'm just checking your balance. Keep your just moving towards you and around. Is it harder to balance while keeping your eyes closed? Just a second like this. Yeah, I know. Okay, good. I would like to ask you to stand on one leg now. Just stand on it. Are you having a hard time? Here are my hands in case you need it, but just try to stand. Okay. And now with the other leg. I see. Alright. Yeah, from what I can see, it's quite hard for you to have balance, and it makes a lot of sense because your joints are very loose. So with your joints being so loose, it's really hard to, find the balance. And again, this is what brings to injury then. Okay. Alright, so the exam is pretty much concluded today. I can see that you have many of the requirements of the Ehlers Danlos Syndrome case. One thing that I can tell you is that there is no cure for Ehlers Danlos Syndrome. So now that you know that you most likely have it, we can maybe do a genetical exam to see if there are even more complications in terms of blood flow. I don't think you have POTS. Okay, by the exam it looks like your blood is going nicely, because sometimes when you have POTS or very bad blood circulation problems, by just standing, your arms could get really red, especially your hands and fingers. So I would not think that you do have POTS, but we want to make a genetic exam if that's possible, so we can further see if you have other types of EDS other than the hypermobile. Okay. And I am glad that this diagnosis helped you realize that you were not coming up with any fantasy, and that there is actually something different in your body. So the chronic pain you feel, the fatigue, find a justification in this condition that is actually so hard to diagnose. I am very sorry that no doctor before ever told you that you could have this condition, and that nobody addressed you here for this exam. In adults, we usually check that once a year, but I would like to see you in 6 months from now, okay, to see how things progress and maybe schedule you for a genetical exam, okay? Thank you so much for watching this video. I just wanted to have a little talk about EDS before I close the video today, because it's a very sensitive topic to me. And as we approach May, that is the month of EDS awareness, I just wanted to talk a little bit about this and maybe spread a little bit of awareness through this medical roleplay. And if you didn't find it helpful or informative, I at least hope it gave you tingles. I found it inspiration for this video in my personal story. And I have to admit that many times I got quite emotional because it's really hard. And when you see people laughing in your face, you start questioning yourself at some point until you find a doctor that believes you. And oh my gosh, it feels so good. So thank you so much for your time and attention. I tried to tell Grace that I am very grateful to her because she really did illuminate me on what was going on with my body, what was wrong with me, but I couldn't get to have her noticing my messages. So if you happen to be in touch with Grace, please tell her that I am so thankful to her for helping me find an answer and finally making me understand that I am not crazy and that I am not inventing everything, because at some point you feel like you're just coming up with excuses because people don't believe you. They see that you look fine because on the outside there is nothing wrong with you, and they don't believe you when you tell them that you're dying on the inside for apparently no reason. So thank you, Grace, for making me believe in myself and for making me find out about this condition, and that the fact that all my pain actually has a justification. Thank you so much for your time and attention. Please, if you like this video, don't forget to leave a comment down below, leave a thumbs up, and subscribe to my channel for more tingles and relaxation. And if you want to see more of my content, all my links are down below. Bye.